Lady Diagnosis.
Hello, Dr. Steve.
What do you have for us today?
Well, I've got a question. Can I go
Yeah,
ahead and dive right
yeah,
in?
please.
Okay, so if you have to poop and you hold it in, what happens? Because eventually the urge to poop goes away,
Correct.
and I think I have figured out that it turns to a rock. Is that correct?
Eventually, it will. There,
Okay.
there are kids with a condition called encopresis, and these are kids that are constantly shitting their pants, and their parents think, well, they don't know how to, they don't know how to control their stool or whatever. That's really not what's going on. If your kid is 12, 13, 14, and they're constantly pooping their pants,
Yeah.
they have encopresis, and there's something going on. So what's happened is um, um, a lot of times they have to go at school,
Right.
and then they won't go. So they
Mhm.
hold it and hold it and hold it because they don't want to go in that bathroom. And there's a lot of reasons why we need to just have individual bathrooms in schools.
Agreed.
Lots of reasons
Totally
these
agree.
days.
Oh, yes.
Think about it for 5 minutes.
Yeah.
But and anybody who went to school back in my time, unless you were one of the cool guys, you dreaded going in there. So anyway,
Yep.
the kid holds it and holds it and holds it. And as Lady Diagnosis correctly pointed out, the feeling goes away. Well, maybe it doesn't come back. And then the next day, they start having the urge at school and they hold it again. And then they get exactly what you said, a colon full of concrete, but also the bowel loses the ability to sense when it's full because they've held it so long. It's just desensitized it to it. So the bowel expands and gets bigger and bigger and bigger, and then it gets to a certain size, and then it just gives up, and it never regains its ability to sense the stool. So what happens now is they've got this colon that's full of poop, and more is coming, so it just pushes it out. And so now these kids look like they're just shitting their pants all the time. And it's like, well, wait a minute, I potty trained you when you were 2.5. Why are you all of a sudden now? So very often it is a psychological factor that they're holding their stool for a certain reason. Maybe they have a rectal fissure. That happens. They get, some of these kids have terrible diet and they get this big giant, American hard turd that causes a rectal fissure. Now it hurts for them to move their bowel. So it could be that. Or they're holding it because they're terrified to go into the bathroom at school. And it's one of the two things usually. And so you got to talk to them about it. And there is a protocol for this. But yes, that's what happens when you hold it too many times. Now, as an adult, if you just don't want to take a dump in your car because you're driving home and you hold it and the feeling goes away, you normally it'll kick back in when you get back home and you can move your bowels. If it doesn't, then yeah, you could use a stimulant laxative or something like that. But yeah, if you continue to do that, that's what happens. Now, the protocol, since there may be some people out there going, oh gosh, that's my kid. The protocol for encopresis is to completely clean them out. So you have to give them enemas
And start all over. Huh?
and you got to give them, laxatives from above,
Right on.
which would be like Miralax or polyethylene glycol. That's from above. We
Right.
give them a bowel prep, basically.
Okay.
And get them completely cleaned out. And when you decompress the bowel, if you keep it decompressed, and then they'll continue to give them laxatives. A lot of times they'll give them mineral oil.
Oh, wow.
And you'll keep giving them mineral oil until you can see it leaking out of their ass.
Oh,
and then you know
goodness,
you've
yeah.
given them enough.
Right on.
And you want to keep that bowel decompressed because over time it will regain the ability to sense poop, and then they'll go normally again.
okay.
Gotcha.
But don't yell at them. They can't help it. They don't know why it's happening either. It's not like they're like, oh, well, I'm just not going to,
Because your stomach would hurt eventually, wouldn't it?
Yeah, yes, but not in these kids. Or
Right.
sometimes they have chronic abdominal pain. They just don't even think about it.
Hmm.
Hello, Mel B.
What's up?
Hello.
It's NP Mel B, everybody. And we're just talking about encopresis.
Poop.
Yep. Kids shit in their drawers. Now, my tent mate in Boy Scout camp
Uh-oh.
had encopresis.
Mm.
And he was just known as, the guy that shit his pants all the time.
Shitty
Nobody knew what
pants.
was going on. And he was a nice kid. I really liked him, but he just
Blessed.
constantly was shitting his pants. And that's what it was. And I remember one time we were in the lake. We were all in the lake swimming together, and this turd just floated.
Oh,
by.
Lord.
And I looked at him. I
God.
went, seriously, dude? And he just gave me that sheepish look.
Ugh.
Yeah, she had just
Blessed.
shit in the lake.
That has to suck for
Poor
him. though.
bastard. Anyway, I hope he got better. But most of those kids eventually will get better as they get older. But it's hard to survive the stigma of crapping your pants, and particularly in middle school.
Mhm.
Yuck.
So again, if
'Cause
your kid
kids
is
are
doing
so
that,
mean.
let me look and see
Yeah.
if this protocol, because we use this on one of my kids, and it's called You Can Poop Too. Let me see. You, the letter U, can poop to.com. Let me see if it still exists. No, it says it's not secure, but it still exists. Let me see. Yep. Okay. Yep. It is an encopresis help site. Oh, and it has a picture of Millie Bobby Brown on there. Why do they have that? That's horrendous. I hope she actually had encopresis and she agreed.
Work through it, baby.
And she agreed to having her picture on a website about people who shit their pants.
Blessed.
Was it 2 million children in the United States have encopresis? Means they cannot control their bowel movements, have poop accidents in their underwear. Sometimes people use the words soiling or fecal incontinence. They put that in quotes to mean encopresis.
So, at what stage do you have to get surgery to have it unimpacted?
Well, you would not normally ever have to have surgery. Enemas usually will do it, but every once in a while, I've had maybe 2 in my career where the gastroenterologist had to go into the colon.
You
with,
better have to get some music for this one, I think.
Oh, okay, you want some good music?
Yeah.
Okay, yeah.
We need some music for this.
I'm
Okay,
feeling
yeah,
in the
yeah.
mood.
Oh wait,
Oh, wrong
wrong
one.
Okay.
Here we go.
So they have to go into the colon with a colonoscope and just chip it out. No, it's not very. It doesn't really deserve sexy music. But anyway. All right.
Well,
so,
sometimes they actually have to kind of remove it like with their fingers, just a digital, removal of some of the stool if it's close enough to get it with your finger.
right. Yeah, you can do manual disinfection.
Yeah.
We also have milk and molasses enemas.
Now,
Mel B, you were
never heard of that.
Are you serious?
No.
Mel B,
Come on.
you were a nurse.
Yes.
I mean, you're still a
Still
nurse.
is
but,
technically.
I
yeah.
mean, did you ever do a
Yeah.
milk and molasses enema?
I did not.
Wait a
do
minute, your
milk
mic's
and
not on,
molasses.
honey.
Hey, sweet.
Hang on. Okay, now you can turn it on. Yeah,
Is that
okay.
better?
Yeah, that's
There
way
you go.
better.
Okay.
Yeah.
So, did you ever do a milk and molasses enema?
No, never did milk and molasses, but I did talk to a doctor about it once. We
Yeah.
ended up doing soap suds instead.
Okay, yeah. So milk and molasses enema, you take milk and molasses, hence the name, and then you
Dun,
you instill it into the colon. And my hypothesis always was because turds would just come shooting out of these people's rectums when you did that. I think that the bacteria in the colon would start to crack the milk and the molasses, and it would create gas, and it would just sort of force the stool out.
Mm.
Because it really worked. And then they stopped doing them for a while, and then now we can do them again. So anyway, there you go. All right. So yeah, Millie Brown's on the encopresis site. So maybe she had encopresis. As a matter of fact, let's Google that and see if her name comes up in association with encopresis. Encopresis. And oh, okay. Nope. Okay, it says Millie Bobby Brown wrote a book, then it got weird. Does Millie Bobby Brown have a disability? And does it say if she has partial hearing loss? Nothing about encopresis. Oh, no, wait a minute. Anyone dealing with encopresis? And then it says Millie Bobby Brown under there. So let me just see here. Let's do a, Control F, Millie. And then no, nothing comes up. So I don't know why her picture is on here, but it's the website the letter U can poop to TOO.com. And it used to be free. I think they charge a little something. Now, this was a university program originally, but it's very helpful, and it gives you that whole protocol of cleaning the kid out, keeping them cleaned out, and then having them sit on the pot and trying to poop, and then getting back into a routine. But ask your kid if it hurts when they poop, because it probably does, or are they being messed with at school? Those are the two things.
Yep.
The two big things. Okay. All right.
Got it.
That was a good one, Lady Diagnosis.
Right.
I'll give
Thank
you a bell
you.
for
Self
that.
a bell.
Tacey will get mad about that. She is very proprietary about those damn bells.
She is.
Anyway, Mel B, you got anything for us today? Anything gross or disgusting or?
I did see that STDs are on the rise for people over 55.
Oh, really?
Yes.
Oh shit!
Yay.
I turn
Uh-oh.
55 next
That
month.
means they
Wear a
fuck.
condom.
We're in trouble.
That means they
Oh.
fucking know.
That's true. That's true. I'm in trouble. I'll be 56 next month.
Good for them.
Just say no, Scott.
I'll just have to use some protection, I guess.
Yeah, the
I'd-
CDC says reports are on the rise.
I'd like,
Chlamydia is
least
running
an
wild in the
STD.
nursing
At least
homes.
try to get an STD.
yeah, I'd like to. So let me ask you something: are they detecting more? Or is there really having more? Because I know, like, what I've heard is that place, the Villages in Florida, is
Mhm.
just rife with
Number one in the
STDs.
United States.
Well,
Yeah.
It's
Is
not
that
just
true,
like
though?
nursing
Oh, yeah,
homes
totally.
and places like that. It's everywhere.
Yeah, and there was a dude that got busted down there for like having a whole bucket full of Viagra's and
Ooh.
Cialises that he had brought in from China. Or
Mhm.
Oh, really?
Canada or
Well, and they
something
think
like
that that's
Okay.
part of the reason
Oh, I
that
guarantee it.
numbers are rising is because
people
men
be-
have
people.
a way of
Mhm.
getting treatment
Oh.
for erectile dysfunction.
Oh, you
So
think
people
that's
are
what it
just
is?
having more sex.
Oh, heck yeah.
If you go to stuff.drsteve.com, there's a non-pharmacologic treatment for erectile dysfunction, which is the shockwave therapy. And that's been it's got some decent data, at the right energy levels. It stimulates stem cells and, increases blood flow and all kinds of stuff. So, yeah, there's all kinds of different things now. There's the PDE5 inhibitors, phosphodiesterase inhibitors that increase nitric oxide, which increases blood flow into the penis and helps restrict blood flow out of it. So if you're pumping more than you're pumping out, stuff's going to happen, right? Then now we have apomorphine. Apomorphine is a great erectile dysfunction drug for people who don't respond to just the PDE5 inhibitors by themselves. But the thing about apomorphine is, if your dog eats a pound of chocolate and you take him to the vet, they give him a shot and it makes them throw up, right?
Mhm.
Well, that shot is apomorphine. That's what they use. So if you take too much of this stuff, the reason it never made it onto the market as an FDA approved pharmaceutical from a pharmaceutical company
Mhm.
was because there was so much nausea. But if you get it in really low doses in places like online pharmacies like Rugiet or any compounding pharmacy, they'll mix 2 milligrams of that with, say, 20 milligrams of Cialis, and it works better than the Cialis alone. So anyway,
Well, there you go.
here we go. This is what the AI is telling me, and AI never lies. The Villages, Florida, is known as the STD capital of America. Now, it's maybe known as that, doesn't mean that statistically there's more, but let's see in the media. But this myth has been debunked. Oh, boo.
No.
The number of Floridians reporting a new STD has tripled over the past decade, but state data shows that 3 counties the Villages reside in have much lower transmission rates than most of Florida. For
Maybe
example,
some
Not buying it.
treatment and some
Not
condoms.
buying it.
Dr.
Not buying it.
Marivek Villa, an internist who runs a health clinic in the Villages, says she doesn't see many STDs. Well, they're not going to tell her.
That's because they're going off campus to get some treatment.
I would say that's true.
They have their private docs off campus.
The myth has appeared in the New York Post and the Daily Mail, and often cites signs that the Villages are engaging in casual sex or dating as an evidence of heavy transmission within the retirement community. However, research of the nightlife in the Villages found many one-night stands and serial monogamy, but not a swinger scene. Well, nobody's saying it's a swinger
No.
scene. It's just one-night stands.
Yeah.
Yeah.
That's why I'm going there.
No
Look, there's
commitment.
some
commitment,
hot
that's
old
right.
ladies. You know.
Oh yeah.
So
Just got to be careful with those total hips.
well. I think I'm probably fixated on that because of my, early experience as a 17-year-old,
Yes.
having my virginity, taken by a 44-year-old and almost by a 65-year-old with the greatest tits I've still ever seen to this day. So there you go. Present company, not,
Of course,
excluded.
of course.
Excluded.
Thank God.
Well, thank you, Dr. Steve.
Yeah, there you go. Yep. Still my biggest regret. I didn't stick around.
Round two.
Yeah, to have round two with the 65-year-old. It was 7 a.m. and I'd been up all night, and I was totally freaked out.
As you
What a
should
weird,
be.
yes, what a weird first experience. Usually it's like your girlfriend, and it's uncomfortable, and
In
you
the
don't know.
backseat.
Yeah, and neither one of you know what the hell's going on. In this case, the 44-year-old really did not know what was going on.
No,
Well,
yeah.
I mean, she wasn't passed out. I don't mean that. I mean, she was able to give consent. I mean, she was terrible.
Oh, my
God.
God.
Here
No,
we
no, no.
go.
I'm saying, well,
We may have to rewind that
why?
tape.
No, I'm saying
She wasn't
So
completely
she
passed out.
knows
it wasn't.
sort of.
She was cognizant of what was going on. She just didn't know how to have intercourse in any sort of entertaining way.
Do we need to have an episode about consent?
Uh-huh.
No
There
means
you
no.
go. That's
No,
right.
this has nothing to do with consent. I'm making sure that everybody's aware of that because of the way I said
If
she didn't know what was going on.
If she can't tell you her
It
birth
was a
date or
fucking
whose
joke.
presents-
God damn it. Fuck off.
What a lady douchebag!
Oh.
I am too smart. I am too smart. I am too smart.
Well, that's
I am
because you're
smart.
an idiot.
Yes,
We better be good. He's gonna kick us out.
Oh.
Yeah, you're just stupid.
Stupid.
But anyway. No, listen.
We're here-
there's a-
we're
no,
here-
there
we're
was
here
no
for you.
issues with consent. I couldn't give consent. I was 17. I could, that if we want to talk about consent, I was a minor. I
You
wasn't
were a
allowed to
baby.
give
Oh,
consent.
you were consenting, though. I bet
But I
you.
did give consent. Fuck yeah, I did. I was
Over
all
and
about it.
over.
But I just, in retrospect, absolutely the worst intercourse that I've ever had. And you think, well, how could anybody, a woman particularly, be bad at intercourse? All they do have to do is really lay there. But that's really not true. It's no fun.
So she's dead now, right? So
I don't
she's not
know.
going to be listening to this.
She's
and go,
not
"Damn
listening
it,
anyway.
Damn him.
Okay, but I would think as many times as I've told that story that they would have called in by now.
Mhm.
But one of them has got to be. I think we calculated she'd have to be 96 now.
Mm.
Oh, and there was this delightful young man, and I took his virginity. So okay. So 44 minus 17 is what? That's what, 24? Is that no 27?
More than that.
Is that right?
Yeah.
No.
15.
Okay,
23,
why am I
20.
such an
Like
idiot?
28 or
30.
something.
It's not 30.
I think it's 12.
Oh my God.
I think it's 27.
Echo, it's 27.
I already
27.
forgot. the
Echo, what's
question.
44
It's-
minus 17? Echo, what's 44
That's a
minus
question.
17?
44 minus 17 is 27.
Yeah, eat my ass, all of you guys. Okay, so Echo, what's 68 plus 27?
68 plus 27 is 95.
Holy
Well,
cow.
there you
That's
go.
the young one.
Yes.
Right.
The old one's
Right.
got to be longer.
Oh, I would hope.
Well,
She
Google
probably-
it. Google it. See if she's still alive.
Okay, well, I don't know her
Yeah.
name. I didn't know either
You
one of
don't
their
even
names.
know her name?
No, I was playing. Have I not ever told you this story? I was playing piano in a bar illegally, and they picked me up. It was two of them. They were on a girls' weekend or whatever, and there was an old guy that was hanging out with the 65-year-old, and he just booked it and left me with these two
Was
women.
he old, like 68?
No, yeah, he was old. He was old. And he just took off and left me with these two women. Well, so eventually, I had intercourse with the 44-year-old. She was pretty hot.
Mhm.
Don't get me wrong. She was pretty hot, but she was kind of dumb and, and just wasn't, it just wasn't an
Well,
interest.
can we say she's having sex with a 17-year-old?
Right.
So she's not smart.
Correct. Good point. And they knew how old I was too. So That's a good point, Lady Diagnosis is a very good point. But I was so nervous I couldn't complete the transaction. So we were screwing and screwing and screwing and just on and on and on and on. And finally, she fell asleep and I said, well, I guess we're done. And that's how exciting I was, maybe. But I mean, it was 6:30 in the morning. I just sort of laid there for a minute. I said, well, I better get out of here. The sun's coming up. And that's when I got out of bed, got my clothes on, and then I was trying to sneak out of there, and the 65-year-old goes, "Hello, doll."
Oh my God.
And and then I realized I was having intercourse with the fun girls from Andy Griffith. You remember them?
Yes.
You remember that? The one is, "Oh, Bernie," and then the other one's,
Yes.
"Hello, doll."
Hello,
Well, anyway, she
doll.
says, "Hello, doll," to me, and I'm like, "Oh, hi," and she said, I watched you, doll," and I'm like, "Oh my God," and she said. And then, she said, I was awake. We kept her awake, and she watched us. And then she said the thing that scarred me for life. She looked at me and said, "I masturbated, doll." And I was like, "Oh my God." And I said, "Well, I gotta go." And she goes, "Why don't you stick around?" And I'm like, "Nah, I really gotta go." And she goes like, "Why?" And it's like, "Well, because the sun's coming up." And then she took a glass of
I
water.
gotta go back to high school.
Yeah.
And biology starts in 40
Right.
minutes.
7:15. I gotta go.
I was on summer break, but still, that's hilarious. And so she takes a glass of water that was on her nightstand, and she had one of those silky things on, like nightgown, like that old lady silky kind of thing.
Yeah, like your grandma would wear.
Yeah. But it was silky. It
Like
was
a moo-moo.
no, it was silk. It was
Oh.
really thin fabric.
Okay.
And she took this glass and went, "Oops," and she poured it on her chest. And then
Oh,
now we're talking about
Mm.
a wet t-shirt situation, except it was silk, which I still have a thing about this. Okay.
Mhm.
So she takes my hand with her hand
Mm.
and she rubs it all over like we need to rub,
The water off.
yeah, we need to rub the water off. And so she
Uh.
takes my hand and is just rubbing it all over
Oh,
her
talk
tits.
slower, Steve.
I know. And then and then I was so freaked out, I just said, I gotta go. So I left. And this is one of my biggest regrets
And
that
you
I didn't
left
stay.
her hanging?
I did, yeah.
Oh.
Well, she could obviously she was, she was okay with masturbating to me and her friend, which is just
Well, at
so
least she didn't
weird.
join in. That would have been awkward.
It
That's a
would have
pretty
been
bizarre-
awesome.
Ah.